Let's talk about fibroids and black women and women of color and what kind of effect. Because I see a ton of women with fibroids. In fact, I think I sent you a couple of patients that had fibroids and they were having issues with fertility. And I guess what I learned is that fibroids are not a big cause of infertility. Or maybe you can correct that for me.
It really depends with fibroids. It's not just the size of the fibroids, but really the location that's important as far as their impact on fertility. Fibroids are very common among women of all ethnic groups, but black women are affected more than any other group. By the time we get to menopause at about 50 years old, 80% of women will be diagnosed with fibroids. So that's a huge amount. For black women, we have fibroids that develop earlier in our life, they get bigger. We have multiple fibroids. We get more surgeries, hysterectomies and myomectomies for fibroids than any other ethnic group. So it significantly impacts our general health, our reproductive health, and our fertility. Again, when it comes to fertility though, fibroids can be very big, but just on the outside of the uterus. And if they're on the outside and away from the endometrial cavity where a pregnancy implants and grows, then those may not have the same impact as a tiny fibroid that's just in a bad place. If it's inside the cavity, that can affect implantation of early pregnancy.
You know what? I think I need to go back. Tell us what a fibroid is, because I think a lot of times we use the term interchangeably, but
exactly.
A lot of women are like, is it cancer? Is it cancer? I'm like,
right.
No, it's not cancer. Tell us what a fibroid is.
A fibroid is a benign or non-cancerous growth of the smooth muscle within the wall of the uterus. The whole body of the uterus is made of smooth muscle, and for some women there can be a tiny little focus of this muscle that continues to grow and forms a ball and can just enlarge over time. Depending on the size and the location, fibroids can give women symptoms of pelvic pain, pelvic pressure, very heavy menstrual periods, irregular bleeding, and then they can also be a cause of infertility.
Okay, so you're not going to die.
Right.
So that's the catch-22.
Right.
But they can cause problems with fertility. And once again, you need to be evaluated for the fibroids and location and whether they're blocked. Let's jump now to, as we evaluate women for infertility. And we were talking once again on stage. We were like saying it can be a little expensive. So pre-apt care is good. But more importantly, the most simplest way to look at a couple, and as a male, I'm like, of course, men can do no harm and no wrong. Okay, so and no man wants to think that he could be the cause for not being able to get a woman pregnant.
Right.
But as we were talking, male factor is a huge problem.
Yes.
With fertility. Talk to us about what women need to think about and get that courage to go and approach that man they're dealing with.
Yes, male factor, like you mentioned, is a huge problem when it comes to infertility, and about 25% of cases are related to a male factor issue or a problem with the sperm quality or the sperm number. And because of that, we always complete the evaluation of the couple at the same time. There are plenty of couples who come in with the assumption that it's just a problem with the woman because she has the eggs and the menstrual cycles and they want to focus on that. But we look at the whole couple, and while we're evaluating ovarian reserve and making sure that the woman's uterus and fallopian tubes are normal, we complete a semen analysis at the same time. And again, about a quarter of cases do have some issue with the sperm, either by itself or in addition to female factors as a cause for the infertility.
And we want women to recognize you cannot be shamed into saying, okay, you know what? Because I think a lot of women feel like it's all me because I give birth, then the problem is me. You need to basically get that young stud to in and get a sperm count. And before we start doing a major, and once again, do not let them do a major workup on you until you have a sperm count, because it could be something, and it doesn't necessarily have to be volume of sperm. It could be morphology, the shape of the sperm. Exactly. The little guys aren't swimming, the soldiers aren't swimming upstream.
Exactly.
And it could be a lot of those things. And as men, we don't like to think that, but there are treatments that can help men correct that problem. We treat them all the time. So it's not a shameful thing, and do not be shamed to say, all right, Buster, in the closet, here's a cup.
Yes. Yes, it's one of the easiest tests to complete. We have to do all of this indirect testing to get an idea of our egg quality and things like that because our ovaries are in our pelvis inside our body. But it's very easy said as a woman, for a man to just give a sample in a cup, and we can look directly at the sperm, and again, we can get all of those parameters of how many sperm are present, how they're moving, how they're developed, are they morphologically normal, and that is key before we do any kind of treatments to have that. And it's very unfortunate if women, complete their testing and we don't have a semen analysis, and they undergo expensive or invasive testing or treatments, and then later on we find out that sperm was an issue. So we always evaluate that first and either exclude that as a factor, or we address that and can do treatments to help with that.